Conversations That Matter is a partner program of the Center for Dialogue at Simon Fraser University. The production of this program is made possible thanks to the support of the following and viewers like you. Welcome. It's an honor to have you here.
Thank you.
You have a very distinguished medical career. Can you tell me a little bit about what got you into medicine? What was it that attracted you to become a physician?
Well, I was brought up in a very traditional Chinese family, and because my parents were working, so I've been brought up with my grandparents. I remember when I was at the age of 12 or 13, my grandfather suddenly developed a very serious illness in which he vomited blood all over the place at home. And I was the teenage little boy, have to call the ambulance and take care of him. And that was absolutely shocking for me. And in the whole process of bringing him to hospital, seeing the surgeons, and then he explained to me that he got a cancer in the stomach and nothing else can be done. I was devastated, and I was at that time saying that I hope to become a doctor so that I can do something for my grandfather. So that's part of the reason, but I always like to do medicine because I think this is a very unique position, unique profession, that you can use what you learn to help people in a very direct way. To help people not just to alleviate their pain, the physical pain, but also in many occasions, patients brought their family problems, their emotional problems to you, and if you are a good listener and if you do care about them, you may be able to alleviate their psychological pain. So I thought that was quite a worthwhile profession.
You grew up in Hong Kong, correct?
Yes.
So at the time, it's a British protectorate or colony.
Yeah.
And you have exposure to both traditional Chinese medicine and a Western allopathic model. You choose the allopathic model. Why did you choose to go that way first?
Well, because even at that time, although a lot of us use Chinese medicine, especially herbal medicine or bone setters when we have injury of the arms and so on, there was no formal training for Chinese medicine practitioners. A lot of TCM practitioners were apprentices of their masters or son of a TCM practitioner. So the kind of training was very limited and very unstandardized. So Western medicine training is the only one which is well established under the British governance and also widely accepted. And people in Hong Kong, I believe in many other Chinese communities as well, tend to think that if you have a serious illness, something that might require an operation or some very effective medicine for pneumonia, for meningitis, you should go to see a Western doctor. But if you want to keep yourself healthy, or if you want to recover well after a surgery, then Chinese medicine will offer you something. So we kind of differentiate the role between traditional Chinese medicine and conventional medicine, which was Western. And the most important lesson that I have learned, however, is not about science. It's about the humanistic aspects of medicine. Because I start to realize that patients, what they need is more than just medicine, more than just physiotherapy or x-rays and so on. What they need is a doctor who really show their care and interest to talk to them and not try to avoid them because they might be contagious. And also the family who are waiting outside but not allowed to come in for visits, they need us to pat on their shoulders and tell them that everything is going to be all right. So the humanistic part of medicine, which I think is a losing art these days,
Why?
becomes very important.
Why do you think that we're losing that art?
Because medicine in a sophisticated tertiary referral hospital is mostly about technology. And the care of a patient these days has been compartmentalized. into various specialties. So when you come in, it will be your ER doctor who looks after you, and then a few hours later you go up to the ward and you've been seen by a surgeon who think that you need a CT scan, and you go to the radiologist. And every step of the way, you are seeing a different doctor, a different group of people who actually don't have the time to know about you very much. So you may need to repeat your story many times, and they might be too busy to listen to what else do you have. So you feel that you are in a very cold place. And sometimes we feel that practicing medicine in such an environment is almost like a factory, and you are just on the assembly line. You've been fixed by various people.
So at what point along your path, your journey, do you now start to examine and study traditional Chinese medicine?
And that was at that point that we found Chinese medicine has something very unique. You know, in traditional Chinese medicine, you've been seen by a doctor who actually always asks you about your symptoms. He looks at your tongues, he feels your pulse, and he checks your eyes and so on. And he do it like every 2 to 3 days. And then he want to change his medicine according to his findings. It's much more humanized in a way. And I was also invited by the WHO to Beijing to examine a few Chinese medicine formula that they used at that time for the treatment of SARS. Although the physical, although the data may not be very convincing to show me that these drugs are really useful to combat the viral infection, but I do believe that it helps people to recover from their pneumonia, from their cough, from their suppressed immune system. So I do believe that Chinese medicine has a complementary role to play with conventional medicine.
I've got to ask you to hang on for just 1 second while we take a quick break. We'll be right back. Conversations That Matter is a not-for-profit program made possible thanks to the charitable support of the following and from viewers like you. Please visit conversationsthatmatter.tv and help us to continue to produce this program. Thank you. So you start to examine this more, and today you now are fully immersed in both worlds, are you not?
I would say that I am not immersed in both because I'm still primarily a Western medicine doctor. I know very little about Chinese medicine, but in my position, I am capable of setting up an environment in which TCM experts can work hand in hand with conventional medicine specialists.
Do you find it remarkable to be able to say that? Because I remember at times when people would say, no, the two are so completely different that you can't operate in the same environment and that you're at odds with one another, or there wouldn't be acceptance from either side. To be able to say that they can work hand in hand, is that a positive move forward from the perspective of the patient, from your point of view?
Well, we do this because we believe that it will provide the best care for our patient. But this is not without challenges and difficulties. You mentioned that Chinese medicine and Western medicine actually works on totally different paradigms. And we think that we cannot insist on using one criteria or one set of criteria to assess the efficacy of the other sets. And I sometimes call it using a Chinese ruler to measure a Western distance. It doesn't really work that way. So you have to have some respect for the other way of thinking, the other philosophy, the other paradigms. So that's one thing, respect. The second thing is you have to realize that in the past, what they say integrated medicine is that when a TCM doctor thinks that, I don't know what's going on with this patient, I better send him to a Western doctor. Or a Western doctor say, well, there's nothing else I can offer this patient, send him back to the TCM practitioner. That's not really integration. Integration, in my mind, is that the two of them join hands to provide the best care to the patient in a holistic way. So this is what we are striving at, to try to put together the best of care in terms of medicine, in terms of physical and mental health for the recovery of the illness.
So you pointed out that you deal with the gastrointestinal tract, that you're a specialist there. How does having an appreciation of both approaches help you as far as your work is concerned?
So there are many conditions in gastroenterology which Western medicine helps, but not totally relieve all the symptoms of the patient. It may not actually be able to put them back on 100% recovery. For example, a very common disease called irritable bowel syndrome, which I think about 30% of the population do experience at a certain point. They present with diarrhea or constipation, frequent abdominal pain. Yes, we can give painkillers to these people. We can give drugs that stop the diarrhea. We can give drugs that allow the bowel motions to start. But it doesn't regulate the body in such a sense that they feel that they are all right. We are just controlling the symptoms. And Chinese medicine, by a certain formula, which may need fine adjustment from day to day, seems to offer something very, very good for the patient. And we have also tested even acupuncture may help the brain to regulate the intestine in such a way that the pain symptom or the pain perception can be altered. Or put it the other way, the bowel can be calmed down and the brain is not so easily stimulated so that the patient's symptoms can be relieved. And we have proved this in a very scientific way, that we apply acupuncture, although we do not know what exactly it is doing. But after 10 sessions of acupuncture, we put the patient in the functional MRI, and we found that the patient's brain reaction to pain is quite different.
So as a scientist, when you say we can't exactly identify what happens, but the result is there, what do you have to go through to be able to become comfortable with that movement away from here's the scientific empirical evidence, we know that if I do this, this is what the reaction is going to be, to I think this is going to work? Is that a challenging transition for you to go through?
And I need some time to convince myself that I can accept this kind of evidence too. Because I was brought up to believe that double-blind, placebo, randomized controlled study is the gold standard. And it is still the gold standard in Western medicine. That you know everything is under control except one factor, which is positive in this group and negative in the other group, and you do it in a randomized way and assess the outcome. But this may not be possible in the study of many Chinese medicine treatment modalities. However, we start to do something what we call pragmatic trial, in the sense that we may not know and we may not be able to control everything in one treatment regimen, but we do it in the conventional way, and we do this in the Chinese medicine way, and then look at the outcome. And we can compare the outcome in a sort of blinded fashion. For example, I am a doctor. I don't know whether you have received TCM or received Western medicine. I don't know exactly the process, but I can assess your symptom, I can assess your psychology and so on in an objective way, and I can tell whether there's a difference between them.
Unfortunately, I've got to ask you to hang on for a moment longer while we take this second of 3 breaks. We'll be right back. Conversations That Matter is a not-for-profit program made possible thanks to the charitable support of the following and from viewers like you. Please visit conversationsthatmatter.tv and help us to continue to produce this program. Thank you. It has to be challenging when you consider the pressure of dealing with the number of patients that you have to see in the course of a day, a week, a month, a year. a Western allopathic model gives you an opportunity to move towards a diagnosis and potential treatment fairly quickly, to, as you point out in under traditional Chinese medicine, I need to see you frequently and help get feedback from you as to how your body is responding. How do we make that fit into the world of delivering healthcare to a large number of people?
So you are talking about the issue in a different angle from the
Yes.
healthcare system, whether we can cope with a large number of patients by using traditional Chinese medicine, which need more time, more frequent visits, and so on. I don't think I have a solution for that. All right, but I think we have at least some kind of patients who might be benefit more by this combined approach than the others. So if I have pneumonia, which can be treated very effectively with a few days of antibiotics, I might not need to go to a TCM doctor. If I have a cancer, which requires surgery, then I go straight to a surgery. But at a certain stage of my disease, I might be benefit from the TCM way of recovery or rehabilitation. So I don't think every patient needs to go through the same path.
Right, because that is where, you know, theory runs up against reality. Okay, how do we deliver this?
Of course.
So from an individual's perspective, what's the benefit to them from seeking out the, you know, the care from a traditional Chinese medicine practitioner around being well, staying well, getting even better? As Dr. Stephen Ong says, you got a sharp knife, keep sharpening it, make it better. Is there a role that TCM can play that the, you know, the Western medicine medical practitioner isn't so much in the position to do because they're dealing with more acute issues?
I can only say that I'm still a student in studying Chinese medicine. I don't know what is the sharpest knife in that sense. But in many situations, we find that Chinese medicine is good to restore the lost balance of our body. So it is probably more useful in prevention of serious illness. It's more useful in helping people to recover from a major illness and stay healthy, instead of in the acute phase of a bleeding or a ruptured blood vessels or a blockage of coronary heart disease and so on. So I do believe that a lot more can be done to find out how they fit into each other to provide the best care.
You said something quite interesting there, to find the balance. How important is having balance in your life when it comes to your well-being?
Well, in the Chinese philosophy, everything is a balance of yin and yang, right? I mean, our environment, the globe, surviving on a very delicate balance, and as well as our human body. So we cannot have too much of this kind of food and lacking totally of the carbohydrates or the fibers. So a lot of things is really a balance. So in the Chinese philosophy and Chinese thinking, health is keeping our balance. And in Western medicine, this is the term sometimes we use called homeostasis, and that is to keep the balance of the electrolytes, of our hormones, and so on. So it's not totally contradicting.
I wish we could keep going, but this is our final break. We'll be back in just a moment. Conversations That Matter is a not-for-profit program made possible thanks to the charitable support of the following and from viewers like you. Please visit conversationsthatmatter.tv and help us to continue to produce this program. Thank you. So as a GI specialist with an interest in traditional Chinese medicine, what do you believe is the best kind of diet, lifestyle combination for somebody to follow for optimal health?
Well, first of all, you don't eat too much. You don't eat too little. All right. So when you feel that you are full, you should stop.
Stop.
All right, or maybe even before you feel that you are full, you should stop. So the volume is something important. And then you should have a balance of meat and vegetables and carbohydrates, and that is also important. I think to have more organic food, more vegetables, instead of having more alcohol, more meat, it's certainly healthy for your life.
As you look at the healthcare landscape ahead of us, for all of us, how does it look as far as the delivery of healthcare in helping people recover from illness and then stay healthy? As you look into the next 10, 15 years, are you optimistic about how well we're going to be?
I'm both optimistic and pessimistic. I'm optimistic because I know that there will be many more advances in medicine, robotic surgery, genomic discovery, personalized medicine. And these are all very effective tools to give us better and quicker healing of our diseases. But I'm pessimistic because if we are relying too much or relying just on this technology, then we are dehumanizing medicine. And the patients who might actually get his fever down and his tumor being removed, but their psychological aspects of the illness have not been properly taken care of. So I think training of future doctors, from the days of medical students to junior doctors, we have to emphasize on the lost art in medicine, and that is to put back the holistic aspects of the care into their day-to-day management.
So, not wanting to put all that responsibility only on the healthcare practitioner, what role does the patient or the individual play in being able to seek out a holistic approach to their own well-being? Do we individually carry some of that responsibility?
Certainly, everyone should take care of their own health by living a healthy lifestyle in your diet, you don't smoke, you don't drink too much, and so on and so forth. And also, there are many things I believe we can do to prevent diseases, and sometimes go to do some exercise and do some Tai Chi, and go to a herbalist to seek health advice. They can give you some health food and so on, may be very useful. So certainly the patient, or actually everybody, have an important role to play to keep himself healthy.
Yeah. Thank you very much. Appreciate you doing this.
Thank you.